on here, everyone. Todd Houghton here from Houghton Physical Therapy in Attleboro, Massachusetts. Excited to be here for episode number 48, Facebook Live Todd's Tip of the Day. So my tip of the day this week is on teenage knee pain and the top 3 knee injuries and where you can look before treating the knee. So in this episode, I'm going to go over a few reasons why starting with the knee will never get you the result that you want. I know it sounds kind of weird, but I hope you tune in and listen just to a different way to think about things. So again, my name is Todd Houghton from Houghton Physical Therapy. I've been a physical therapist for almost 25 years, and I'm just passionate about helping people. I'm excited about having the patients that go somewhere else and don't get better, the ones that have had a long-term chronic injury. I really get excited about those cases because I know that's something that I'm going to make a difference on. If you have any questions, please feel free to ask your questions here live, or any questions that you ask, I will make sure that I get back to you. You can also contact me at toddh@houghtonphysicaltherapy.com, or you can reach out to me on Facebook, private message me, and I answer all the emails or questions that I do get. So here we go, my favorite part. The top 3 knee diagnoses, especially for a teenager, and where you want to actually start looking so you can get better. So the first one is patellofemoral syndrome, fancy word for knee pain, fancy word for a kneecap injury or a kneecap issue. So what would a patient commonly say? Well, they have pain above their kneecap, they have pain to the side of the kneecap, they have pain under the kneecap, usually with activity, with walking, stairs, sitting. It can be many different things, but usually it's pain around the kneecap. Objectively, what might a physical therapist find, or what might I find? They will find that the gluteus medius muscle on the side of the hip is tender. They'll find that the tensor fascia lata is also tender, which is on the side of the hip, a little bit in front. I'm also going to find every single time a weak glute max muscle, gluteus maximus muscle on the same side. I'm also likely going to find that the lumbar spine vertebrae and the low back, mostly all the same side, are tender. And the biggest one I find is a lack of core stability. Not just a lack of core stability, they might be able to hold a plank, but they're not able to have core stability, sometimes even at all, but also they're not able to use it through a movement pattern. So what is a typical treatment? Most places that you go, you're going to get where they're going to treat the symptoms and not the source. So what do you want to look out for? So typically you'll get a knee brace, they'll have you do quad sets, strengthening the quad, which is the front of your thigh. They'll have you do hamstring stretching. They'll have you do some kneecap mobilization, Graston or dry needling to the knee, and also probably taping the kneecap. Through my eyes, I tend to take a little bit different look. Is the first thing I'm going to focus is on the fuse box. Find the starting point and find out where is the core stability issue or the lack of core stability. What do we need to do to align the spine? Because we know all the vertebrae are stacked. When you're in really good posture, all the vertebrae are stacked, all the nerves work well. When the nerves don't work well or they're not firing well, then we have weakness, pain, and sometimes numbness and tingling going down into the legs. So number one is look at the fuse box, the core stability. I'm always going to treat the thoracic spine, which is the mid-back, because I know the neck is a stability piece, I know the low back is a stability piece. In the mid-back, the thoracic spine is a mobility piece. If the mobility piece is not working, then we can't stabilize with the neck or the low back. The next thing I'm going to do is I'm going to treat the lumbar spine. I'm going to use manual techniques on the lumbar spine to make sure it is working properly. I'm going to do some core stability exercise. I'm going to find their starting point for the low back. I'm also going to work on hip stability. And then I'm going to do trigger point release to the glute medius and to the tensor fascia lata, which is on the side of your hip, which can send referred pain to the kneecap. Number 2, the second diagnosis is iliotibial band syndrome, IT band syndrome. What would a patient typically say? They'll say, I have side of the kneecap pain, I have pulling on my kneecap. It's just very painful, usually with activity. Objectively, what a physical therapist might find, they're also going to see that it's going to be tender on the glute medius muscle because it also refers pain down to the IT band, simulating even sometimes some lumbar radiating symptoms down all the way down to the foot. The tensor fascia lata is also going to be tender. Again, weak glutes, tender to the lumbar spine, mostly same side where the kneecap pain is, lack of core stability. Are you noticing a pattern? Same thing for the knee with the IT band as with the patellofemoral syndrome. So what are the typical treatment again for IT band syndrome? Knee brace, quad sets, hamstring stretching, patella moves, Graston, dry needling, taping of the kneecap, and you realize that you're not getting better because it's treating the symptom instead of the cause. So through my eyes, what am I going to do? Same thing. I'm going to look at the fuse box. I'm going to find their starting point with the core stability. I'm going to treat the thoracic spine, which is a stability piece. I'm going to treat the lumbar spine through manual different techniques. Core stability exercises starting at the low back and the abdominal muscles, working to hip stability, and then I function down more towards the knee. I'm going to do a trigger point release to the glute medius, tensor fasciae lata, again, because why? It refers pain down into the knee. The third diagnosis that we'll talk about that are really common in teenagers are hamstring strains. Subjectively, what are people going to say? They have pain behind the knee, pain in the mid-back of the leg, pain in the upper hamstring, more towards the glutes. Objectively, what a physical therapist might find, can tendon to the glute medius muscle, hamstring soreness, that a lot of times goes away with releasing the glute medius muscle. Tensor fasciae lata is tender. Glute medius, of course, on the same side are going to be involved. Tender on the lumbar spine, and also lack of core stability. Now, people might be doing the right exercises, but just at the wrong time, or they might not have the proper form of doing the core stability exercises. Very commonly, people say, oh, I've done that before, and we just have to kind of fine tune in and just see where they're off. So again, typical treatments, they're going to do Graston to the hamstring. They're going to stretch the hamstring. They're going to do quad strengthening. They're going to do hamstring strengthening. They're going to do dry needling, Graston, and probably even do some of the KT taping for the hamstring to take off some of the tension. So again, through my eyes, what am I going to treat? Fuse box number 1. Number 2 is the lumbar spine. 3, the thoracic spine. Again, core stability exercises. And in my eyes, when we address the problem, which is a stability issue along the spine, everything should just melt away. I don't remember the last time I actually had to work on someone's hamstring or even touch their knee to treat their symptoms. Just finding that it works out. So if you're not getting better, I hope that this was helpful just to give you a different point of focus. Please feel free to reach out to me with any questions that you have to my email at todd@houghtonphysicaltherapy.com. Reach out to me on Facebook. So hopefully this was helpful. Please feel free to tune in next week, and I hope we see you next week for episode 49. I'm getting close to 50, the big 50.